Hello PGs, welcome to my channel. I'm Dr. Mohini and today I am going to teach you Fuchs Uveitis Syndrome, how to write in exams and what are the important Viva questions. I'll give you a two-page framework for writing Fuchs Uveitis Syndrome. Along with the framework, I'll keep on highlighting examiner's favorite questions. So this is the initial framework for writing Fuchs Uveitis Syndrome in exams, and let's expand on each heading on how to write in exam. So it is always important that you start your answer with a clear definition. So what are the things that you should mention in definition? That it is mild, it is unilateral, chronic, non-granulomatous, anterior uveitis. And this is examiner's favorite question, that is it granulomatous or non-granulomatous. It is important to mention all these words and your definition is complete. Sometimes old examiners, they are very fond of asking that who was the first person who defined Fuchs. So you remember this name in epidemiology. Just mention that laterality, that usually it is unilateral, but 5% are bilateral. And it affects mainly young population of 40 years of age. Now etiology. Etiology is mostly idiopathic, but today it is very important to know the association with rubella virus. And if the examiner is young, he will definitely ask this question. So you remember that it is associated with rubella virus. Rarely, HSV, CMV, and toxo, they have also been seen associated with it. And that's why it is a most probably viral infection, and that's how they have very limited role of topical steroids. Next, we write about clinical features, divided into symptoms and signs. Fuchs, in Fuchs, the eye is usually quiet. So you remember as white, quiet eye. Unlike other uveitis where there's so much of pain, photophobia, and circumcorneal congestion, Fuchs does not have these symptoms. It's a very low grade inflammation. So this is important to remember. Now, very important part of Fuchs. If one thing, if you can remember one word from this video, just remember Amsler shine for science. Remember, Amsler shine for science. So this is a mnemonic I have given you. And if you remember this mnemonic, you can go for short note without referring anywhere, anything. And you can go through your Viva also. Now let's see one by one. So Amsler is for Amsler very sign. So very commonly asked question in Viva. And you remember it as Amsler sign, we discuss it. S for stellate KP. Now, important thing is that it is diffuse, unlike other uveitis where arch triangle is involved, but here diffuse KPs are present. H for heterochromia iridis. I, iris atrophy. You have to remember here also that here iris atrophy is diffuse, it is not sectoral. So this is also important Viva question, examiner's favorite question. Then iris nodules like Basaka and cave nodules, iris vessels. Now there are fine neovascularization with bridging vessels over angle. And that's how when a surgeon, it goes into anterior chamber, they have this tendency to bleed and it comes as hyphema. And this is known as Amsler sign. So this is important Viva question also and very important to write in exam. The examiner is looking for all these words which I am telling you. Now, very, very, very important point. As we know, all uveitis cases, they have posterior synecdoche formation. But in few, there are no posterior synecdoche. There are no posterior synecdoche. So you have to remember this for writing exams also and for Viva. Then E stands for early cataract glaucoma. These are two common complications of Fuchs. So you remember this as Amsler shine for science. Okay. So next heading is investigation. So in investigations, generally do not write long list of investigation for Fuchs. Just keep it focused because mostly it is a clinical diagnosis. Very rarely, interior chamber paracentesis is done mainly to detect rubella-specific antibodies in aqueous humor. And this is recently known for subfoveal thinning, but still evidence are not that strong. Then next is for investigation mainly for cataract and glaucoma, mainly for complications. You can mention this as number. Now, one thing,
not everybody will be writing is revised diagnostic criteria versus LAHI criteria versus Sun classification. This has been recently published. I'm going to share you one article, and in this you can read about this just for extra knowledge and extra marks in writing in exams, because not everyone will be knowing this. Now, regarding treatment of Fuchs uveitis, it is simple. Topical steroids are not given for long. So it is very, very important Viva question, and examiners, they are looking for this only, that you are aware that this is a type of uveitis. You avoid steroids for long term. So examiners are looking in exams, they are looking that you have written that topical steroids are not given for long and they are generally avoided. Only for moderate exacerbations, topical steroids are considered. Otherwise, there are no actual role of topical steroids in flu. So in Viva also, examiners are fond of asking this, and while checking your answer, this is important. Then second important thing in management is that you mainly treat the complications like cataract and glaucoma. So for cataract, you go for surgery, phacoemulsification plus posterior chamber intraocular lens placement. And in glaucoma treatment, you go for medical or surgical. Mainly medical management is there, and you can manage with anti-glaucoma drug. Rarely, very rarely, pars plana vitrectomy can also be done. Some books mention this also. For dense vitreous opacities, you can go for it. But keep your main focus on treating the complications, and topical steroids avoid long term. So this is a very quick revision for Fuchs uveitis syndrome. And that's how we have completed Fuchs uveitis syndrome in just 5 minutes. Your short note is completely ready, and all the Viva questions I have given you here. So just revise it smartly, write it in a structured form. So now let's see that are you able to write in the performer or not. It's a very short performer. Now you remember definition. You have to mention 5 points: that it is mild unilateral, chronic, non-genital, anterior uveitis. So your definition is complete. And if you can mention about Ernst Fuchs, the Austrian ophthalmologist name, then you can earn one more point. In epidemiology, just like that unilateral, it is unilateral in 5% cases, have bilateral and mostly affect young age. Etiology, we have already discussed, and in recent, you have to write about rubella virus. For symptoms, just remember that it's a quiet eye. There are no redness, photophobia, and distinct symptoms. Just this is one of the most important part of today's video. That you remember this Amsler shine. Now this is a mnemonic I have given you, and now you know all the signs of Fuchs. S for stellate caping. Remember diffuse. Heterochromia iridis, iris atrophy. Remember diffuse. No no posterior synecdoche, and E for early cataract and glaucoma. In cataract, you remember that 80% cases are posterior subcapsular cataract only. Investigation, I told you, just mention the names of investigation and treatment. Write the role of topical steroids that you give it, but not for long term, and you treat complications like cataract and glaucoma. So here we have completed. So if you and examiner are talking about Fuchs, get ready for the next questions like Amsler sign, and remember shine for sign. Before we finish, let me ask you one thing. Do you actually know where all in ophthalmology the word Fuchs and Amsler appear? So here I am to help you out. So you remember this. So whenever you are revising Fuchs, don't forget to revise this, because sometimes the examiners are interested in knowing the named sign. Thank you for listening, and comment below for the next topic. तब तक के लिए, off the